how are you doing? I hope you are doing well, and welcome to today's session of learning. In our previous topic, we listed some of the most common sexually transmitted diseases, and I promised that I'm going to handle each of them separately so that we can see the different clinical features, how they present, and also we see if each one of them, the causative agent, so that we can know for the bacteria and also for the viruses, the ones that are curable and the ones that are not. Yes, so that when you see these symptoms, you rush to the hospital for treatment. Okay, so if you're new here, feel most welcome. If you're a member, karibu tena. If you have not subscribed, please consider subscribing and let's grow this channel. And also, if you have any suggestion, ask me down there in the comment section. So today we are going to talk about gonorrhea. And gonorrhea is sexually transmitted, and its causative agent is a bacteria called Neisseria gonorrhea. So this bacteria often affects the urethra, the rectum, and also the throat. Okay, depending on how it was transmitted through the route, depending on the route of transmission. So gonorrhea is treatable by medical professionals. So whenever you notice that you have the symptoms, you are advised to go early to the hospital for treatment. The population that is mostly affected by gonorrhea are people between 18 to 35 years, simply because these people are sexually active. Some people don't have information about these sexually transmitted diseases, so that's why this population is the most affected population. Okay, so I want us to list the symptoms of gonorrhea. We know in male how does it present, and also in female how does it present. So the symptoms of gonorrhea most of the time appears in a period of 7 days after exposure. Okay, so after you are infected, in a period of 1 week, you will see the symptoms. But some people may not show any symptoms until the disease has affected the reproductive system. But if you are lucky, if you see the symptoms early, just go to the hospital and you will be treated. Okay, so I want us to start with the symptoms in male. What are the symptoms of a person who has gonorrhea, and this person is a male person? Number one, frequent urination. What do I mean? If in a day you urinate, let's say 4 times in a day, when you are okay, when you contact gonorrhea, you will have frequent urinations. You might end up going triple the times you go for urination in a day. So if you go to the toilet to urinate 4 times, when you have gonorrhea, you might end up going to the toilet 12 times in a day. Okay, and also number 2, we have a pus-like discharge from the penis. If you notice you have a discharge from the penis that is pus-like, it might be white, it might be green, or it might be yellow. Okay, the discharge might be white, green, or yellow. If you notice this kind of discharge from your penis, make sure you seek medical attention very fast. We have swelling or redness itchiness at the opening of the penis. If you notice, it has become swollen or it's red, that's a sign of an infection. We have swelling and also pain on your testicles. We have persistent sore throat, okay, and also we have anal itchiness, bleeding, or painful bowel movements. This one is for those male who have sex against male, okay? A male people, let's say gay in short terms, for gay people, it affects the rectum, okay? And the symptom of gonorrhea that has affected the rectum is pain during bowel movements. When you are going for your long calls, you will have pain. There will be bleeding and also anal itchiness, okay? That is for male. For female, we have unusual discharge from the vagina. It can be greenish or yellowish. We have pain or a burning sensation while urinating. This one also appears in male. We have frequent urination, also pain or burning sensation when urinating. We have frequent urination. You go to the toilet so many times. You triple the number of times you go to the toilet normally. We also have a sharp pain on your lower abdomen. We have a sore throat. We have bleeding in between your periods. And also we have pain after sexual intercourse. Those are the symptoms that a lady will experience when they have gonorrhea, okay? So what are the prevention measures for gonorrhea? Number one, always use a condom when you're having sexual intercourse with a partner you're not sure of their status, okay? If you're having sexual intercourse with somebody whom you're not sure of their status, just use a condom. Number two, we have get a test done if you are suspicious. If you don't know your partner's state, you can get a test done to just confirm if they have gonorrhea before you engage in sexual activities with that person. We have avoid sex with people who have symptoms. If someone tells you you want to engage in sexual activities with someone and then they tell you they list two or one of the above symptoms, just avoid sex with that person, okay, until you test and you know that they are okay. But of course, if they have a symptom, means they might be having an infection, so you are not safe, okay? Number four, have long-term mutual monogamous relationships with a partner without gonorrhea, okay? Mutual monogamous relationship means get someone who is having a relationship with only you. Both of you have a relationship with only one partner. You have one partner. So make this relationship a long term, okay? Once you confirm that this person is not infected, okay? So what are the risk factors? What predisposes you to, or who is at risk of getting gonorrhea? Someone, if you practice sex with more than one partner, if you have more than one partner, you're at a risk of getting gonorrhea. Number two, sex with an infected person. So this one means you just go having sex blindly with someone you're not sure of their status. So if they are infected, then they will infect you. So if you're a person who just have sex with someone you're not sure of their status, then you're at a risk of getting gonorrhea. You also have young age. I said this population, teenagers, this is the time they are exploring so much. They want to know what is sex. They want to have sex with multiple partners. So the worst part is that they don't have information that there are these sexually transmitted diseases. So they end up getting infected. We also have mother to baby. A mother who has gonorrhea and they are pregnant and they don't get treated, then they put their baby at a risk, because if they're going to give birth to this baby through the normal way, they're going to pass it from themselves to the baby. So this baby is at a risk. Okay? And also having sex, man having sex with another man. A man having sex with another man, gay people. These are the people who are affected at the rectum. Okay, because that is the route of transmission. Can I say that's the... Okay, gay people, you know how they practice sex. So if this bacteria goes to the rectum, then it affects the rectum. That is how they end up getting symptoms like bleeding from the anal region, itchiness, and also pain during long calls, bowel movements. Okay? So what are the complications of gonorrhea? So if you see these symptoms and you ignore them, you don't go for treatment, what will happen? For ladies, you will have what we call pelvic inflammatory disease. This is a severe damage to the female reproductive organ. Imagine if you get damage to your reproductive organs at a young age when you've not given birth. Number 2, we have scarring or blocking of the fallopian tubes. And if the fallopian tubes get blocked, then you will not conceive. Number 3, we have scarring of the urethra. This is for men. Number 4, we have abscess formation in the interior of the penis. This is for men. This is very painful, and also scarring of the urethra is painful. We have ectopic pregnancies for female. So if the fallopian tubes scar, okay, or they are blocked, then you're most likely to get an ectopic pregnancy. You're at a very high risk of getting an ectopic pregnancy. We also have infertility. You see how serious gonorrhea can be. It leads to infertility. So if you see these symptoms, just go for treatment. Okay? Early treatment leads to a good outcome. So what is the treatment? Gonorrhea has cure. There's a cure for gonorrhea. And then because it's a bacterial infection, you will be given antibiotics. Do not buy over the counter. Don't prescribe medications for yourself. Go to the hospital, get tested first. Your doctor will do a urine test to confirm gonorrhea. And also they can do a urethral pass, a swab. That pass, they can swab it, or a throat pass is for those people who practice oral sex. If you practice oral sex with someone who has Neisseria gonorrhea, then you will have a sore throat. So for a throat infection, a doctor can do a throat swab. For the rectum, they will do a rectum swab, okay? And it will go to the lab for testing. So ensure you finish your dosage. If you don't finish your dosage, then it's better you even don't start, because it's not going to help you. Okay, do not share your medications. You go to the hospital, you have gonorrhea. you are prescribed your medication, don't come home and start sharing your medications with your partner. Let them go and collect their own medications. Another point, wait for at least 1 week after finishing your medications before you engage in sexual activities. You've gone to the hospital, you've been diagnosed with gonorrhea, you've been given medications. Make sure you finish your dose. After finishing your dose, stay for 1 week before you start engaging in sexual activities again. Okay? This one gives you a period to heal and also for the bacteria to be killed completely, so that you won't transmit it again to your partner. And then avoid sex until you complete your treatment and symptoms are gone. Of course, you won't engage in sexual activities when you have these symptoms. And then make sure you go for a retest after 3 months, because gonorrhea recurs. Don't think that because you contacted gonorrhea once you were treated, it's not going to recur. It recurs. So if you don't engage in safe sex after treatment, it will always recur. Okay? Yeah. So that is it for gonorrhea. You've had the symptoms. They're so easy to notice. But if you don't notice the symptoms, some people don't see these symptoms, and then they start appearing now when you're having complications. So if you're the unlucky person who won't see the symptoms, your doctor will try help you when you have the complications. But if you see these symptoms early, just go for treatment early. It will save you a lot. Okay? So that is it for gonorrhea. Thank you so much for watching this video. Please remember to subscribe, give it a like, leave a comment. Okay? And also you are free to share the video. Okay? Feel free. Thank you so much. See you in the next session when we will be handling the second sexually transmitted disease.